This educational video was produced by the Department of Veterinary Public Health and Pharmacology of the Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. In the neck region, IM injections are administered to the injection triangle. The vertices of this hypothetical triangle would be the base of the ear, cranial angle of the scapula, and the shoulder joint. This is the injection triangle of the neck region. Injections can be given within the triangle considering the volume of the injection. There are important structures we should avoid in this region: the dewlap, the nuchal ligament, and the cervical vertebrae, the jugular vein located within the jugular furrow, and most importantly, the trachea should be avoided. To administer the IM injection, I am using a 10 cc disposable syringe which comes with a 21 gauge needle. Because of the thick skin, the 21 gauge needle is replaced with an 18 gauge needle, which would also facilitate jabbing. Let us now load the syringe with the drug. Before the IM injection is given, the site should be disinfected with 70% alcohol or a suitable disinfectant in a concentric pattern from the center to the periphery. Then the 18 gauge needle is removed from the syringe and taken out from the cap with a firm grip at the hub using the thumb and the index finger. Make sure to maintain the sterility of the needle by not touching it against any surface. Then the needle could be jabbed at the center of the disinfected region. Then fix the syringe to the hub of the needle. And aspirate to make sure blood is not coming out. Then press the plunger to release the drug into the muscle. Before withdrawing the syringe, apply some pressure using a cotton wool swab at the injection site. Another IM site include the gluteal region of the rump. This region is demarcated by the pin bone caudally and the hook bone cranially, and the IM injection should be given to the central region between the aforementioned demarcations. Caudal thigh region could also be used to administer an IM injection as pointed out in the video. Similar to IM injections, subcutaneous injections can be administered at the injection triangle of the neck region. Disinfect the skin as previously described. As previously demonstrated, the drug should be loaded to the syringe. Make a skin fold by lifting the skin up. Then pierce the skin along the skin fold as shown. Inject the drug into the subcutaneous space. Make sure not to pierce the skin perpendicular to the skin fold. Similarly, the subcutaneous injection can be given at the axillary region as demonstrated. First, the site would be disinfected in a concentric manner from the center to the periphery. Grab the skin to make a skin tent and insert the needle into the subcutaneous space inside the tent as demonstrated. Based on your preference, either you can make a skin fold or a skin tent in any of the locations while administering a subcutaneous injection. And now we are going to demonstrate to you how to access the jugular vein for venipuncture and intravenous drug administration. This is the location of the cervical vertebrae. And below is the jugular furrow. Within jugular furrow, superficially, you can find the jugular vein. And deep within lies the common carotid artery and the carotid sheath. Ventral to the jugular furrow, you can feel the trachea. You have to avoid the trachea when accessing the jugular vein, which is inside the jugular furrow. Now we are going to demonstrate to you how to arrest the jugular vein in order to access it. First, press the jugular furrow at the level of the thoracic inlet with your fingertips in order to allow the jugular vein to bulge out. Alternatively, you can use the jugular clamp to arrest the jugular vein. Jugular clamp has two arms and a knob to adjust the gap between the two arms. Depending on the thickness of the neck, make sure to adjust this gap. As shown here, apply the jugular clamp at the level of the thoracic inlet above the level of the jugular furrow, so it gradually slips into the jugular furrow, compressing the vein. Now you can see the bulging of the vein. You might not find a jugular clamp under the field conditions. Therefore, we are showing you another easy technique. In the field, you can use a rope or the neck belt of the animal to arrest the jugular vein. First, put the rope around the neck of the animal and apply a bowline knot as demonstrated. Move the neck belt formed by the rope towards the thoracic inlet and firmly grab it to compress the ventral neck region as demonstrated. Now you can see the bulging of the jugular vein. Then you may disinfect the area. Then pierce the skin and the vein at 45 degrees angle to the surface as demonstrated. Pull the plunger back to see whether blood is coming into the syringe in order to make sure the needle is inside the vein if necessary. Before pushing the plunger, relax the rope to let blood flow. When you are administering an IV injection, direct the needle towards the heart. If you are drawing blood, you may direct the needle towards the head of the animal and not in the direction of the heart. Make sure not to direct the needle at a 90-degree angle to the skin surface in order to avoid the structures lying below the jugular vein in the jugular furrow. Now we are going to demonstrate how to administer a drug to the epidural space. You can access the epidural space by the sacrococcygeal junction or by the first intercoccygeal junction. In order to find out the correct location, first hold the tail of the animal 6 to 8 inches away from its base. Then keep your index finger of the other hand on the spinous processes of the lumbar vertebrae while pumping the tail up and down. Move your index finger over the spinous processes along the surface towards the base of the tail. Then you will feel a movable junction, which is the sacrococcygeal junction. This is one site through which you could reach the epidural space. If you further move the index finger caudally, you will feel a second movable junction, which is the first intercoccygeal junction. This is the second site through which you can reach the epidural space. Once you have identified the specific location, clip the hair and disinfect thoroughly. Then insert a 18-gauge needle into the epidural space through the selected site. When you are inserting the needle, make sure to direct the needle in a cranio-ventral direction at around 15 degrees angle to a perpendicular plane of the animal as shown. There are a couple of ways to ensure that the needle has reached the epidural space. The first way, you will feel a pop sound as the needle enters the epidural space. Also, you can put a few drops of the drug to the hub of the needle and see whether the drug will move freely into the animal's body as shown. The third way is to connect the drug-filled syringe to the hub of the needle and pull the plunger back to see whether air bubbles are coming without much resistance. Instead of air bubbles, if you see blood, the needle has entered the subarachnoid space and you need to pull it back to enter the epidural space. Do not administer drugs into the subarachnoid space. Once you have confirmed that the needle is in the epidural space, you can slowly administer the drug. Suppose you have administered a local anesthetic like lignocaine. You may see the lifeless hanging of the tail after 2 to 3 minutes. Now we will demonstrate how drugs could be administered orally to a large ruminant like this cow. Simply, you can drench a cow using a bottle. In order to drench using a bottle, place your body against the animal in the neck region and restrain the head by holding from the nostrils and turning back towards the body and directing it upwards as shown. Then, while holding the nostrils, use your familiar hand to open the mouth through the diastema. Irritate the upper palate to relax the lower jaw while restraining the head. Then, release the nostrils and grab the bottle using the same hand and insert the bottle into the mouth closer to the commissure of the mouth. The bottle should be directed towards the pharynx. Alternatively, you may use a stomach tube. Before inserting the stomach tube, the head should be restrained properly. Here we have used a bull holder. This is the stomach tube we are going to use today. Make sure the stomach tube has a smooth edge to avoid injuries to the esophagus. Also, you may select a tube with a lateral opening or a lateral eye to facilitate passage of the drug into the rumen without any blockages. Before inserting the stomach tube, we need to place a mouth gag between jaws as demonstrated. This will prevent biting of the tube by the animal. Mouth gag can be secured to the horns, neck belt, or someone can keep it in place. Next, lubricate the stomach tube with liquid paraffin or a suitable lubricant. Before inserting the stomach tube, roughly measure the required length of the tube to reach the rumen so that you know how much to insert into the animal. Then carefully insert the tube over the base of the tongue into the esophagus. Allow the animal to swallow the tube. While inserting the tube, you can blow into the tube by your mouth to facilitate the movement of the tube inside the esophagus without any injuries. After inserting the tube partially into the esophagus, hold some cotton wool in front of the outside opening of the tube to see whether any air is coming in and out of the tube. This is an important step to check whether the tube has accidentally gone into the trachea. If the tube has gone into the trachea, you will see movement of the cotton wool corresponding to breathing of the animal. If you don't see any movement of air in and out of the tube, you can further insert the tube towards the rumen. Once the tube has reached the rumen, you can smell the rumen content. This is another way to verify that the tube has entered the rumen. Now you can administer the drug into the animal by fixing a funnel or a stomach pump to the stomach tube.